With me today is my special guest. His name is Dr. Gbenga Kumpoluyi, a public health physician. And today, he's helping us to explain some of the terms that we use when we're talking about weight as it pertains to human beings. Dr. Gbenga Kumpoluyi, you're welcome to the program.
Thank you very much, Kwame.
Okay, so I'm going to be asking you a few questions, asking you to help our viewers, help them have a better understanding of some of these terms that they'll be hearing on this program from time to time. Okay. So the first one, of course, is what is weight and does it really matter?
When we were in school, they told us that matter was anything that had weight and occupies space.
I remember that one.
And I thought that's strange, you remember?
I do.
Now, out of that matter, you then take weight, as a singular thing out of that.
Okay.
Now, when you say weight, you're talking about the amount of substance that any body contains that you can find in a thing, in a body or in anything that has matter. That's the amount of weight that you have in it, substance it contains.
All right, thank you very much. Now, let's look at when does someone know, when is weight too much and when is it ideal? How can we know that? Because our viewers will want to know. They want to understand. I mean, somebody could tell an individual, yeah, okay, everything is fine. And they say beauty is in the eye of the beholder.
Yes.
So somebody might be looking at you and saying, oh, you're okay. What really, from a medical practitioner's point of view?
If somebody is telling you, okay, let's hope your body is telling you that you're okay, because those are two separate things, that can happen. But when it comes to weight, just like this program says, weight actually matters.
All right.
Now, because if you start, quote and unquote, fooling around with your weight to the point where it gets out of hand, it's not just that people may say it, but you're going to start feeling uncomfortable. Your body has a way of telling you that something is wrong here. Okay. Now, we're going to be as basic and as simple as possible.
All right.
And one of the most simplest things that we use for people to have an idea of what their weight is something that we call the body mass index.
That's
or
the BMI.
BMI.
Very good.
Now, the BMI is a simple calculation. Okay. You get on a scale and then you take your weight. Make sure that scale is in kilograms. Your weight in kilograms, and then we take your height in meters. Okay. So let's assume that your height is 1.5 meters. Then we square your height. Okay. All right. Then we divide the weight. Your BMI equals to your weight over your height squared. Okay. Whatever figure we get is your BMI. All right. That BMI gives us an idea, of what your weight is, because it ranges from about 18 to well over 40. Okay, that's the BMI. The BMI itself. All right. Okay. By the time you are hitting a BMI of 25 to 29.9, if that's what you get, you're already getting overweight. Okay. By the time you are hitting things above 30, you're getting to obesity. Okay. Which by the time you are getting above 40, you are getting into morbid obesity. Okay. All right. So you want your weight to be somewhere between 18 and 24.5, you are happy. Or even 25, you are happy at that point. But when you start... That is your ideal weight range. Yes, okay. That's the good range that you really want to be in. Okay. Also, you don't want to be underweight, because when we say weight, there are two sides of the spectrum. Okay. You can have the overweight side and you can have the underweight side, and both of them are actually bad. Okay. Both sides are bad. So you want to remain as ideal as possible within that range, and then so that you have less health challenges.